Hello, I'm Greg Jamian, and thank you for watching Boomer Health at Home, the show where we explore the most relevant healthcare topics impacting the baby boomer generation today. As more and more baby boomers seek answers to many times difficult healthcare questions, our goal is to provide ideas, tips, and cutting-edge solutions that will help improve your everyday life and health. It is our hope that you find the following information helpful as you sit back and watch Boomer Health at Home.
Welcome to Boomer Health at Home. I'm your host, Maggie Ornazian, Director of Nursing at AmeriStaff Nursing Services. I'm joined today by Meghan Gervin, Clinical Nurse Supervisor at AmeriStaff Nursing Services. Hello, Meghan.
Hello, Maggie.
Thank you for joining us again today.
You're welcome.
Today we're going to talk about cholesterol. Cholesterol can be a very confusing topic for many people. There's the good, the bad, and then the unknown. So there's a lot of information changing and circulating around this. Why don't we just start with the simple thing? What is cholesterol?
So cholesterol is actually a waxy fat-like substance that's in your cells.
Oh, okay. So is this something that is natural in the body?
It is. Your body actually produces cholesterol from your liver, and it makes enough for your body to do what it needs to do. So it actually uses cholesterol to help build hormones, vitamin D. It uses it to make things that help with your digestion.
Okay, so some foods can cause the liver to create more cholesterol, while other foods like derived from animal products, like your cheeseburgers and things like that, can cause your cholesterol to rise.
Yes.
Okay, so what happens when all this cholesterol is swarming up around in the body? You're just eating cheeseburger after cheeseburger because it's delicious and you don't care.
It is delicious. We all love our cheeseburger and fries, maybe a little, nice fatty cheese with the wine. It's fantastic tasting. Obviously, you got to have a little bit of that life to make you happy. But it does end up, the cholesterol attaches to plaque in the body. Plaque is what will actually clog up your arteries. It's not just on your teeth. You should go to the dentist anyways. The dentist is great too. But it will actually start to plug up the arteries in your body. So not a great thing.
So like I had said earlier, you hear a lot about on the news, social media, anywhere you can hear anything about the good cholesterol and the bad cholesterol. Well, my good one was low, and my bad one was high. So I am so confused. Help me.
First of all, we're going to start with lipoproteins. So what is explaining the LDL and the HDL are actually talking about lipoproteins. So lipo, fat, attaches to a protein and travels through your blood that way. So it's actually a little combination going on there. So your HDL or high density lipoproteins, those are the ones that are the good cholesterol. And why they're good is because while they're traveling through the blood, they're actually taking cholesterol back to the liver to kick it out of the body.
Okay.
The low density lipoproteins or the LDLs, those actually are your bad ones. Those are the ones that are grabbing on and making it attached to the plaque in the body, and they're taking cholesterol and put it in not so great places in the body. And then there's the very low density lipoproteins, and those are grabbing your triglycerides and actually messing up in the body too. So those are your bad ones.
Okay, all right, thank you for that. I get it now. So HDL is the good.
Good.
LDL is the bad.
Yes.
Okay, great. So what causes this high cholesterol besides a really high fatty diet?
So a lot of it is dietary. A lot of it are those processed foods.
Okay.
the ones that we know are bad for us, high in saturated fats, trans fats, anything that's derived from animal products, meats, dairy products, those type of things. And then stuff that we think we're being healthier with, which it may be healthier than the other stuff, but your palm oils, your coconut oils, those type of things also have a cholesterol component to it that can add into it. And then we always have to look at lack of physical exercise. If you're sitting around a bunch, if you're a smoker, and then some medications and conditions can actually cause it to rise as well.
Okay. Is this something that could be hereditary, like, you know, oh, my dad had heart disease, so I'm going to have heart disease, you know, not that that's the same thing, but is this something that could be
Very
genetic?
much so, very much so. And I mean, it's just the luck of the draw. It's whatever you ended up getting passed down in your family.
Okay.
You could look on the outside to be extremely healthy. You could follow like even a vegan diet and be super healthy, never eat animal products at all, and still end up having cholesterol issues.
So you can blame your parents?
You can blame them for some things. Maybe even your grandparents and great-grandparents.
Wow.
Just keep going up the line.
So when you have these really high levels of bad cholesterol, what kind of health problems can you expect?
So like we talked about before, it's going to attach to plaque in the arteries. So if you think about your arteries in your body as being like the highway system, these are your traffic jams. This is what you're not getting through, so your blood's not getting through. So depending on where it's at is what it's going to be named. So it's named all different things around in the body. So coronary artery disease, it's when plaque, cholesterol is building up and narrowing those areas. If it's in the brain, it's called something else. If it's in the legs, it's, you know, peripheral artery disease. So depending on that, and then actually if your plaque ruptures and then clots it off, then it'd be called like a heart attack, a stroke, and everyone tends to know those terms a little bit more.
So cholesterol is the instigator.
It is a little peer pressure instigator to the plaque there, yeah.
So there are no signs and symptoms of high cholesterol. So how do you get diagnosed with high cholesterol?
You're right, there's no x-ray vision to look in and say, and even though sometimes, you know, we joke around and say, I just clogged up my arteries with that meal, there's actually no real feeling or signs and symptoms. So it is actually just a blood test. It's part of your yearly physical that they would have, and they actually start measuring it in childhood. Because of those genetic components, it can start in childhood and then, you know, have some issues. And then as you get older, because you know, so many things are working against us when you get to a certain point, that they will start to check it more frequently.
Okay. So how does one lower their bad cholesterol and increase their good cholesterol?
So like a lot of different things, it's eating healthy, it's, you know, physical exercise, not smoking. You could do everything right, and the genetics are just not in your favor, and it's going to be high anyways.
Okay. So there's a lot of medications out there for all kinds of diseases and comorbidities. What are the most common for high cholesterol?
So there's a lot out on the market now for high cholesterol. Some biggest examples are your statins. Those have been on the market for years and years, and a lot of people know about them. Some people have had some bad side effects from them. So statins actually work by decreasing that liver's production of cholesterol. But because of the side effects, some people can't tolerate them, or they just need a little helper. So you could get some leg cramping from it or something like that. So then there's other new ones that are coming down the line that are on the market now that your doctor may put you on. So there's Zetia, that one hinders the absorption from your actual intestines. And then there's ones like fenofibrate that like increase an enzyme that can help break it down. And then there's ones like Vytorin that are like a combination of Zetia and statins. And then there's so many more coming down the line because this is such a big problem. It is such a big issue that they're putting the money behind it and, you know, adding stuff on the market. There's even some new injectables coming out that may be like a longer acting. So sometimes you'll be on one or more for your cholesterol, depending on what it does.
So how does the audience find out more information about these new and upcoming medications and how to just lower their own cholesterol levels?
So if you go to a reputable website, we're talking like American Heart Association, CDC, not just Joe Schmo up the street that decided that he knows a lot about cholesterol and is going to post a bunch. You might get some false information. You can use, obviously, your doctor. They're, you know, the experts on this. So when you're at your appointment, ask them about it. Or if you have some friendly doctors in the area, feel free to ask them. And then you can use, the other healthcare professionals in your life, the home care nurses, the pharmacist up the street. They have a lot of information. We're trained on this. We went to school for this. We love to help people. That's what we do for a living. That's why we're here. So
Exactly. Okay, great. Well, thank you, Megan. That was very informative about the good, bad, and unknown about cholesterol. Thank you all for joining us today. And again, if you have any questions or comments, please feel free to contact us at 248-288-2270. Thank you. Stay safe and healthy.